I knew there was nothing going to be wrong, but at the same time, I didn't want to miss any call. You see, this is our UK. Every single thing is paracetamol. At this point, I was getting so frustrated. I was getting tired of just going to the clinic. Baby's asleep, so hopefully we'll get to finish this video just in time before it wakes up. Before I start the video, I'm just going to give you guys some heads up. First off, I'm having cough, so my voice might actually be off today. It might not be because of the mic, it might just be because of my voice, and I'm not using my external lights. I'm just using the natural lights outside. Don't know how it's going to look like, but I really want to do this video. Well, yeah, we're moving. I've got my laptop. We're going to be I'm just going to be telling you the story chronologically. I hope I don't get teary while telling you guys this story. First off, yeah, my pregnancy was good. I had a couple sicknesses, tiredness, loss of appetite, which in itself is normal in pregnancy. And for the first trimester, there were some foods that I couldn't eat anymore. In fact, I couldn't eat chicken, I couldn't eat turkey, and then I couldn't stand the smell of frying oil. So if the oil, like you're frying oil in my house, I would send you packing. Like, I was not having it. For someone that used to eat McDonald's, when I bought it, I threw up. I couldn't eat McDonald's at that time. When I got pregnant, I called my GP and told them that I was pregnant. They told me they were going to contact me. The midwife was going to contact me. So when I met her, she said my BMI was over 30. And since it was over 30, I would need to meet my GP to prescribe a higher dose of folic acid. When your BMI is over 30, they would need to prescribe a higher dose, and the folic acid that you would take would not be, like from the counter. So it would be prescribed just to, avoid that risk of neural defects on the baby. So this was done, and I started taking the higher dose. Another thing that happened during the first trimester was I was having abdominal pain. So there were like up to two or three nights where I couldn't sleep. In fact, the last time I literally slept on my husband's hand because he had to put his hand on my belly, so like under, he had to put, and then I slept on it. That first time that I had the pain, I had to call the maternity unit. In fact, I called them at 3 a.m. My husband called them because obviously I was in pain. So he called them and they said, you know what, just take paracetamol. See, this is our UK. Every single thing is paracetamol. So yeah, I kept on taking the paracetamol, and they told me that it was going to be fine, that it was causing pain as they were stretching. And I was like, okay, that's fine. But I was obviously in pain. I needed something stronger. But because I'm pregnant, I basically could not take any medication that wasn't prescribed, just so that I don't affect the baby, because obviously anything that you take as a pregnant woman may be a risk to the baby. They mentioned that if it continued, that I should call them. So I remember that was a Saturday night. We couldn't go to church on Sunday. What then happened was we couldn't even cook, we couldn't even eat anything. So because basically my husband was just with me, so we had to order food. But he called them, I think, and told them that the pain, I was still having the pain, and then they booked us in for particular time that evening. I think it was around 4 or 5 p.m. They told us to come around. And where we were going to get the food was not too far from the hospital. We took the food, we ate in the car, and we were waiting for our appointment. So when it was time, we went there and they told us that, we were going to see a doctor. So she did some examinations, she asked me some questions, and then gave me a stronger, pain med. I think I was also having some heartburn, so she gave me everything relief for that. And we went home and everything was fine. So this happened like 3 times during, I think, my first and second trimester. Around 8 weeks to 12 weeks, we had the first scan, which was the dating scan. So in the UK, we have up to 3 scans. The first scan is the dating scan. The second one is the anomaly scan, and then the third is the growth scan. During the dating scan, basically they would ask you questions on the last period, and basic questions, and then they will give you a date, right? That's why it's called a dating scan. They'll give you your due date. And at 20 weeks, we got to do the anomaly scan. We got to know the gender because we wanted to know the gender. We were just too excited. We wanted to know the gender, and we got to know the gender, that it was a baby boy. We're so excited, and there was no anomaly. Baby was growing very fine. It wasn't going, overweight. Now fast forward to 26 weeks, around 26, 28 weeks of my pregnancy, I went for the glucose tolerance test. That's the glucose tolerance test. It's also called the sugar test. Now during this test, they would want to know how your body tolerates, sugar, and to know if you have gestational diabetes. Gestational diabetes usually happen during pregnancy, and most of the times after pregnancy, it will, go away. The evening before the test, they will tell you, not to have like a night meal or something, which I did. And then in the morning, you won't have any meal, like any breakfast, nothing. You just come like that. So during the test, they give you, the first of all, take your blood and then give you a very sugary drink, like a syrup, so sugary. Took that. So we were even so many, pregnant ladies came that day. I took that, and after then I would sit for a while, and then they'll take our blood again. So what they said was we should go back, and if we don't hear from them, it means that everything is fine. We don't have gestational diabetes. But if we hear from them, it means obviously that something is wrong. And if you're in the UK, you know that most of the times when it comes to like healthcare, if they don't call you, then everything is fine. So no call means like everything is fine. But if there is a call, then something is wrong. It was early January, so I went to church with my husband because I think we were having like a retreat in church. I knew there was nothing going to be wrong, but at the same time, I didn't want to miss any call. No call came in that day. I was like, okay, thank you, God. No call came in that day. It was good. Okay, we don't have gestational diabetes. Fast forward to my 35-week scan, that was a growth scan. The sonographer mentioned that the baby's belly, the stomach was getting big, or was measuring big. At this point, they were measuring the baby anytime, even while I was visiting my midwife, who would, obviously want to hear the sound of the baby, the heartbeat, and then do some measurements. So when I went to that scan, the sonographer was saying that the stomach was measuring big. And, I jokingly said that, look at the father's stomach. Father's stomach is big. And, my husband and I, we laughed about it. And she was like, I know, right? But this is not the issue. This is not the problem. This is actually a big thing when the baby is measuring big around that stomach. And I was like, what is wrong with them? What is going on? Why is it measuring big around the stomach? What's going on? We were just curious, wanted to know what's happening. They told us to wait behind. We waited. If I knew, a nurse came in, and she came in with this glucose test, and she said she was going to do one today, and that I was going to go home with them with some needles, and I was going to do this pricking test, and I was going to do it one in the morning before my first meal, and then another one before my heaviest meal of the day. And I was like, see, I don't know how to prick myself. I don't know how to put needles on my body. I don't know how to see. My pain threshold is very low. At this point, I was prioritizing my baby. I wasn't, looking at my pain threshold or looking at myself. I was just prioritizing my baby. I'm doing the tests and recording the numbers. I did it religiously. I did every single thing that they wanted me to do, and I was supposed to send the result the following week, which I did via email, and they were going to call me the next day or 2 days after. So they called me and mentioned that I had gestational diabetes, and this was around 30, I think 36, 37 weeks. And I'm like, wait a minute, gestational diabetes, like how? Maybe it's from my meals, but it could just happen in pregnancy, and I shouldn't worry, that I would get to speak with the nutritionist. I had a call with the nutritionist. She mentioned, okay, you know what, you're going to cut down on this, cut down on this, cut down on this one. They were considering if they were going to give me insulin or if they were just going to give me some medications. And since I was already close to, almost 40 weeks, at this point it was 37 weeks, which was like 3 weeks too. So they mentioned they were going to give me some medications that I was going to be taking. I started taking the medications, and for me, I follow instructions. So yeah, we were now booked again for another scan. So this was like 38 weeks. We were booked for another scan. So at that 38-week scan, said that I was going to be induced. So a doctor at first came in and told me, what's your bed plan? What did you plan that you wanted to do? I said that originally, or yeah, what I want is like a vaginal bed because I want to experience that. Although my threshold for pain is still low, but obviously that's what I wanted. I said, okay, yeah, you can still have the vaginal bed, but we'll need baby to come out before 39 weeks. You would need to be induced. Basically, in induction, they are forcing labor. So since I had not gone into labor, I was still, agile. I was still moving. I was so strong. Like, in fact, my third trimester, I was stronger than ever. I was really strong. If you've watched my other video, you will know that it was even during that 36 weeks I went to pick up my mom. My mom came in before I gave birth, luckily for me. So I was strong. I wasn't weak. I was even, when she came in, I was even the one trying to make food for her. Like, I was strong. Labor hasn't started. There was no contraction, nothing. I wasn't feeling anything, any single thing. So what this guy said was that if, labor hasn't started before the 39 weeks, that I would need to be induced because the baby needs to come out. Because I'd already heard a lot of stories about failed inductions, how people go through the pain of induction and then end up in emergency CS. And I've seen online. I'm like, I don't think I want to go through this pain and at the same time be rolled into the surgery room for an emergency CS. At this point, I wasn't happy about every single thing. And because they wanted me to, do an induction, I told them, you know what, I don't think I want to. And if there is any other option, I would just prefer that. A consultant was now invited to talk to me. So she explained induction, she explained how the process was going to be like. And I was like, okay, so what about CS? Why can't I do a planned CS? And she mentioned, oh, there could be complications. Are you sure CS is a major surgery? Are you sure this is what you want to do? Are you sure this is the plan that you have? At this point, a lot of thoughts, a lot of noise, a lot of the noise was just too much, a lot of words, and she was like, okay, you know what, Elfrida, do you mind going home to think about it? And she told me to come again the next day. I said, okay, that's fine. I looked at my husband, we went home, and when we talked about it, my husband was like, he wants me to do what I want to do, that I shouldn't, obviously I wasn't going to be swayed by anybody, but I wanted the both of us to talk about it. It was like, it's going to, whatever my decision is going to be, is going to obviously support it. If I wanted to do the induction, it's going to support it. If I wanted to go for the planned CS, it was going to support it. During our conversation with the consultant, we asked, what if labor starts today? What would happen? And she mentioned that if labor should start, immediately would obviously start the whole process to get delivered vaginally. At this point, we started doing a lot of things to make sure that labor would start. We did a lot of walks. My husband and I, we walked a lot, and I did not feel nothing. I did not feel any single contraction, no pain, nothing. And this was already 38 weeks and some days. And the following day, I think I went again, and that was like a Friday. So I was in the hospital. I was just going to the maternity hospital like back to back. So I think I had gone Wednesday, Thursday, and then Friday. And at this point, I was getting so frustrated. I was getting tired of just going to the clinic. It was getting so overwhelming. And I'm like, I told my husband, I'm tired. I'm tired of coming here. Can they just, bring the form and let me just sign? The induction might be successful, it might not be successful. The CS in itself, although it's going to be a planned one, it's a major surgery, right? And I know I get her points where she was trying to advise to say, I want you to make an informed decision. Me leaflets, she gave me a lot of things to go read. We read them. I also did some research, and I also listened to some persons that had done induction, but the experiences that I got were not favorite. They were not nice. They were not nice experiences. My only consideration is I don't want to be in that point where I say, what if? I did not want to regret this. I mean, I know that I'm going to be fine. The baby is going to be fine. But at this point, I do not want to regret it. I do not want to regret my decision. I wanted a decision where I know that I made that decision and it was good, right? I'd kept an open mind with pregnancy, but I know as a child of God, I believe that it was going to be a very smooth experience. I wasn't losing faith in God. I was even asking God, to give me the strength. I trust that this thing that I'm saying, this thing that I have chosen was going to be the best for me. I want to do the plans here. So I signed, and they gave me a medication. I was going to take a particular drug I was going to take the night before the CS. So they planned for it, booked me in for Monday. So I was going to clock 39 weeks on the Sunday. They won't be doing any operation on the Sunday. So they booked me for Monday. First thing Monday morning, I was going, went home, and we were still doing our walks. My husband and I, we were very, very serious with our walks. Still no contraction, still no labor, no contraction pain, nothing. Like, I think this baby was just enjoying himself. If I had not had maybe the gestational diabetes, I'm thinking that maybe I might have actually gone past 40 weeks, maybe, because this baby, and I'm going to tell you why during the CS, what really happened that made me think like this. All the natural things that we did not induce labor. So we had to go for the planned CS. We went there before 6 a.m. and we were up to three ladies that were going to the surgery room that day. And because I had gestational diabetes, they attended to me first. So, we had to change. My husband was also with me. And I think I'm getting too emotional at this point. But yeah, that's why we changed. They put the cannula into my left hand here, preparing me for the surgery. So they were going to put a local anesthetics in my spine. So we're going to be like a spinal anesthetic down at my lower back. So they did that. When they did that, I shouted. It was so painful. What they made me do was to hold on to a pillow. So I held on to a pillow, and then there was this other lady there in the room, that was very supportive. So she was just talking to me. We're just talking, and while they were putting that, and that alone was really painful. In fact, I started rethinking my decisions or my choices. I started rethinking at that time, but all the same, I was already inside. So they finished that, and at a point I couldn't feel anything, because what it was supposed to do was to numb me from here downwards. And my husband was playing some songs, and we were just talking, and it was really fast. At that point, I felt, obviously you will feel them pulling and pushing, and just you feel them doing something to you, but you would not feel any pain. They had broken my waters, and they were trying to take the baby out of my womb, and he was pushing himself upward. So my my baby did not want to come out. This boy was pushing himself upwards while they were bringing him out. So they finally, successfully brought him out, and that was the time when my husband stood up. And when he stood up, he started crying, and at that point, I too started crying, because it was all emotional, and we were all teary. And he told me that they showed him the baby, but the fact that he saw me open, right, he started crying. It was so emotional. And we started crying together. When I first saw my baby, they handed him, right after they did the whole cleaning, they brought him to me. It was so relieving. Like, I was so relieved. I was crying. Baby was crying. The father was crying. It was so beautiful to hold on, hold my baby. We did skin to skin. It was so beautiful because I hadn't like imagined how it would look like. The doctors asked us why we chose the CS. So I said it was a planned one. It was the gestational diabetes that made me choose it. Told me that this was a good decision that I made because my baby's feet was really big when it came out. In fact, that baby was big when it came out. This is why I was avoiding that regret, right? It's not like I knew that his feet was going to be big, but I just down in me, I didn't want to do that induction. I didn't want to go through that stress. So all the same, they said, this was a good decision. Everybody will just say, congratulations, congratulations. This was a good decision. And yeah, my husband called my mom. She was really happy. She came with food, called the brother-in-law, or just called people and around and told them that we had given birth. They were really happy, rejoicing. That was not the end. We wheeled in, they kept on, checking me, checking my vitals, and then checking if I could now start feeling pain. Before the surgery, they'll put a catheter so that you don't empty your bowel by yourself. So it continued, obviously, after the surgery. I still was using the catheter. And in the evening, they removed it to see if I could, empty my bowel myself. So when I went, I couldn't do that. So they had to put in another catheter. Nothing that happened was when it was time for me to stand up, it was really, really painful. When people think that the CS is actually the easiest route to go, it is not. So I did, walk. I tried my best. I was, leaping. I was trying my best, but at the same time, I couldn't pass on urine by myself. So by myself, I was going to come back to remove it, I think the following week. And yeah, that's fine. We went home with it. It wasn't easy, sincerely, taking the catheter home, having to take my bath, clean myself properly. But it wasn't easy. For that first week, I wasn't working very well. I was, a little bit bent walking, but I was trying my best, to stand up. And that is why I'm really grateful that my mom and my husband were around that the first 2 weeks. My husband had his paternity leave, and at the same time, because I gave birth the week before Easter, he had some days off with the Easter break. So it was good having two, two support systems. After then, we went home, and yeah, everything has been fine. It's not been an easy journey, but it's been good. It's been going on well, and sincerely, I want to thank God because it is not every woman that goes to give birth that comes back with a child, or it's not every woman that even goes to give birth that actually or comes back to our family. But I was able to go, even if I didn't have labor, no contractions. um I never planned to have a CS, but I did, and everything turned out to be in God's plan. That is what I always tell myself, that in the end, it's always God's plan for me, right? It's always God's plan for me. This is my story, guys. I hope this inspired someone. I'm going to see you in my next video. Thank you for watching. Bye.